So welcome to video number 2 in my series on dialysis at home. So here I am setting up hemodialysis for my grandfather who's doing nocturnal dialysis here. The first video was machine setup, and here we are actually starting dialysis and connecting to his catheter. And as you can tell, he's already fast asleep. So I've already, before I started the video, washed my hands, just disinfecting them again. And the pink solution there is antiseptic, because we're dealing with a catheter which is ultimately connected directly to the heart, more or less, in terms of where it connects. It's very important to make sure that everything is disinfected properly and that we don't actually touch the catheter itself, the end of it, with fingers. So basically, cleaning everything very well beforehand using the antiseptic solution.
Yeah, giovedì.
Yeah. And the yellow tips that you see at the end of the catheter, those are things that I change once a week. They're called Tego connectors. Basically just an end cap that serves as a cap, but it also lets you connect syringes to it and also to the machine. So I'm starting on the red or arterial side. That's where the blood comes out and heads over to the machine. We're basically going to just start off by removing what they call the locking solution. Take about 3 milliliters of solution and a little bit of blood mixed in there. That's just a solution that sits in the line because obviously blood can't sit in the line, otherwise it would clot. But we're taking that out. And next, we're going to flush the line with a saline syringe and test to make sure that everything is clean and working in the line. So one thing that's most important when dealing with catheters like this is you don't want to have any type of air getting into the line. And you notice that this technique I'm using, I hold the saline syringe, hold it vertically, and I'm giving it some flicks there, so that air bubbles will just sort of bubble out, and then they don't actually go down the catheter, because obviously that can cause complications and pose a bit of a danger. So we don't want air getting in, but as long as you hold the syringe vertically, you're pretty much okay. And then anytime I disconnect, I'm also using clicking the white clicker to clamp the line down. And so that and the Tego connector, the yellow connector, that sort of serves as a double fail-safe to prevent air from getting in the line. So that's probably the most important thing I think about when I'm connecting and disconnecting. Is basically cleanliness, making sure that everything's been disinfected properly. You notice that when I pick up the catheter tip, I'm not grabbing it by the end, I'm grabbing it by an upper portion. Unclick, flick, and flush the line there. And make sure that I'm following a good protocol so that that air won't enter. And then a second saline flush. It's three saline syringes per side. So in a few minutes, I'm going to repeat the same setup. So one other thing. And this was part of the setup in the previous video. There's something called heparin here, which prevents coagulation, clotting. There's a small little bolus that we put into the arterial line. It's 1.2 milliliters. That's going to go in. That's going to come out when dialysis starts to help with prevent clotting during dialysis. I mean, blood is traveling outside your body and through the lines, so we want to have a small bolus of heparin to make sure that everything is good. So now we're on the blue or venous side. This is the side of the catheter where blood returns to the body after it's gone through the dialysis machine. And once again, if you haven't seen it yet, video number 1, I show the 15-20 minute setup of how I set that machine up. So there we are, the 10 ml syringe with saline. We're going to just check I'm basically pushing and pulling a few times to make sure that the access is good and will actually work. Sometimes things can get a little sticky. I mean, let's say there was a clot in the line, or let's say the Tego connector is worn out and needs to be changed. Just by pushing and pulling a few times, I can sort of get a sense of whether or not the access is working properly. And usually it is. If not, there are a few troubleshooting steps we can do. But for the most part, it's just a double check. So giving it 2 flicks there to get rid of any air bubbles. Connect it down to the venous catheter. Unclick, flick again, make sure there's no air. Flush the line. There we go. And basically we're just repeating things we've done before on the arterial side. So giving it a nice good clean again with the antiseptic. No. And give it one more clean on the side. It's good to be overprotective with making sure that you maintain a clean access site there, because it prevents infection, and it's just a good protocol. So one last check. The machine is sort of recirculating on itself. It's all waiting for us to go. So I click the button, stop the blood pump, clamp off the extra saline that we don't need now, because now we're connecting to my grandfather, the patient. So that white recirculation adapter, the machine no longer needs to recirculate on itself. We're going to connect it now to my grandfather here. So we start by taking the red arterial port, and you'll notice that, again, very careful about not touching any end directly. Even in my left hand, I have it balanced there so that the other end points are not touching anything. So very carefully put in, unclick the lines. So, and the first thing I do, we start it and we want to make sure that blood is coming out properly, everything is connected, there hasn't been a problem. And I'm just double checking that drip chamber there. Sometimes if your venous line gets plugged, let's say that catheter there was a problem, you would notice that it would start backing up. And so we can stop the machine there just to troubleshoot. But for now, you can see blood traveling through the circuit. It's starting off at a slow speed. But more or less we're good here. So we can actually get a little head start on cleaning things up. So there's a clean 4x4 gauze there. And there's a little sensor here called the enuresis detector that basically detects moisture. And this is used for nocturnal patients because it's an unlikely scenario, but if things were to get disconnected, then blood could start leaking out, and we want to be notified of that. So there's a little plastic sensor that just detects for blood leaks, and there's a little alarm that it attaches to. In the almost 2 years that we've been doing dialysis at home, that has never happened, but it's a good fail-safe alarm, because we will be sleeping during dialysis here. So the machine is now ready. The red line at the top means that the machine detects blood in the system. And you'll notice that both lines are now red. The saline has disappeared, and we have blood coming out of my grandfather and going back in after going through that dialyzer. So dirty blood out, clean blood back in. And just taping everything up, just to make sure it's all neatly set up. You can basically arrange the line according to your preference, depending on what side you have your catheter. So a few pieces of tape. And then that's the piece that the sensor connects to detect moisture leaks from the catheter. It basically detects for any disconnection, accidental disconnection. And then a little clamp there to keep everything in the right spot. So the red flashing lights represent the alarm limits. So there's an actual arterial and venous alarm that detects if, for example, things were to kink. Let's say I have everything taped in place, but let's say maybe the line got kinked or something, and so the machine's trying to draw blood out of the body, but it can't. So the machine actually will detect that, and that it has a specified range of acceptable quote-unquote pressures or difficulty in pulling blood out of the body or pushing it back in. And if there is some type of problem, the alarm will sound, and then you can troubleshoot accordingly. So we're pretty much good to go. Just a final thing, once we connect, we want to make sure that all the parameters in the machine are set right. So now that things are running along, I just fill out the form here, put in the date, put in the name, and then there's a few items, a little checklist that we go through. You know, in a hospital setting, that would normally get checked. Parameters would get checked fairly regularly, maybe every hour, every half hour. But at home, it's mostly enough just to check once after you set things up, and then once just before disconnecting and taking off the machine, and then just a final check after everything is done. So hopefully this video was useful. Please ask any questions you have below. More than happy to share our experience. And stay tuned for our next video. Thank you.